Joining me to discuss this is the Executive Director, Health Initiative, Paschal Achunine. Good morning. Thank you for joining us on TVC Breakfast.
Good morning.
Now, the government is talking about intensifying COVID-19 protocols strictly. One, majorly because it is, opening the airspace for more air travels, especially internationally. And we saw that there were challenges even while we reopened the airspace after the lockdown for some period. We talk about the journeys where a lot of passengers were, talking about the challenges they faced in trying to get into the country and the measures put in place by the government. Now, when government is talking about ensuring strict protocols to prevent a further spread, because it has projected a second wave, we do not have details of what government plans to do. But for you, what shape, what measures should be put in place, since we want to ensure that we do not have a second wave, seeing we are also inching towards the Yuletide?
Interestingly, in the last 4 days, we had uncommon incidents of no death arising from COVID-19. But every responsible government should be concerned that since there's a second wave virtually all over the world and is increasing, more lockdowns are happening, and Nigeria is part of the global community, the government must go beyond words.
Right.
If you cast your mind back to 3 months ago, there was a policy statement from the Federal Minister of Health that about 60,000 community health inspectors will be deployed across the country to ensure strict compliance with the protocols. Taking it almost like a template that was used in overcoming polio.
Yes.
We expected that by now, that pronouncement will be backed by execution or action. In my interaction so far, we are yet to see evidence that much has been done in that space. We must engage communities and groups and sectors. First is to do it in a non-threatening manner, because people are already bottled up with a lot of pressure. So you identify.
Why the non-threatening manner?
Yeah, the enforcement is not meant to be very, very harsh. It is for people to understand that this is the risk you stand to face in the event that you continue to ignore the required protocols. And if you also go check across the various groups and platforms where people congregate, whether in the church, schools, hospitals, or markets, you find out that the original protocols stipulated by NCDC are being breached. You also recognize that even though some people may have the willingness to ensure the protocols are observed, some don't have resources. Public schools don't have resources. So there are 3 or 4 steps government must take: effective communication, and not coming from government alone. I think I said it on this platform some time ago that government must identify other partners whose voices the people can trust, in addition to whatever the government say.
So trust is a major issue here in communicating.
And that trust does not go both vertical and horizontal. So if perhaps before now there's a protocol you communicate, you need to identify clusters of stakeholders, and they will pass the message that this is the risk we stand that is facing everybody if this continues. So, and further to that, I talked about communication. I also talk about resources, deployment of resources. And that resources here is not government budgetary allocation. We must recognize that collaboration is required. Private sector cannot just stay aloof. And supporting the government does not just mean putting money into the government coffers.
Okay.
It requires that a credible governance system must be deployed that ensures the private sector keep an eye, the social sector and the government, so that a process that ensures that funds are disbursed effectively. And that resource includes providing something like as little as borehole in public secondary schools where they don't have much of that. Ensuring that if it's transparent process of getting people to access close masks.
Transparency is the key word here
Yes.
that you have mentioned, because you saw what happened after the hashtag #EndSARS protest, where a lot of persons saw the palliatives that government was saying that should be distributed to people, and that also seems to have breached the trust that is supposed to be in place, that is already hanging in the thread. And now saying we need to have a transparent process. A lot of people have come up to say that the process for everything, because we saw how the private sector, came all out to, support government's effort at the lockdown period. Right now, if we are to ensure transparency, if we are to ensure trust, build trust, and also ensure accountability, because these are key things that a lot of Nigerians feel has to be seen for them to believe that government, this thing is real, COVID-19 is real, and that government is making effort to ensure they are safe. How do we begin to build? Because we have limited time.
We have seen how much COVID has done, private sector-led initiative, but how much it trickles down to those who need it is difficult to establish. So what we figure out is that the government must take the lead and the private sector must also reach out. So, okay, we've seen that this thing is a common enemy. COVID-19 respects neither color or class. So these are our recommendations. Government come up with this. Then social sector players, that can also take the place of private sector can do a mapping, identify in the social space who are the credible, which entities are credible that have carried out social intervention programs and they were successful. Right. That can be an important framework that can bring this or get us out of the woods. Otherwise, even if billions in dollars are allocated, it will not get to those who genuinely need it.
Because recent reports is saying that the government is disbursing 66.5 billion naira to states to ensure to address this issue of COVID-19. But the question a lot of Nigerians are saying is, where is this going to? What if we see government saying given figures, but it is not trickling down like you're rightly pointing out?
In fact, that 66 billion, you juxtapose it with a recent report that says over 600 billion have been put together, mustered or mobilized in the course of this COVID-19 from inception to date. And those who are in critical need, besides what has done, what went into infrastructure like setting up the isolation centers and co, but other areas that are the consumables, medical consumables, and other elements that will provide both support for those at the front line, but then the citizens, because people want to desperately move on with their lives.
Absolutely.
Just to shock you, I got a call yesterday. Somebody is a graduate, he has 2 degrees. He was looking for 2,000 naira to buy malaria drugs. I said, please, can I give him that as a loan? That is how serious our situation is. And this person has a family, he's got a child, he's got a wife, perhaps 2 children. What it means is that people, when you highlight the risk associated with COVID-19, people most don't give a damn because they feel that they're already on the precipice, they can die anytime. So government must be sincere in reaching out to social sector, private sector, but again, it does not require that government alone must be the one to take the lead. It's expected that the government should lead.
Yes.
Private sector can put together a blueprint, a program, and engage government from a position of strength and identify, because private sector is into profit making. There are social sector organizations that are credible that can ensure those resources are transparently utilized.
As much as we are looking at the government, the people also have to take responsibility, whether they like it or not. That is what is also being said. In taking responsibility, some have said that we do not see this being real. I recently went for the burial of a doctor who was said to have contracted COVID-19, and we saw how the families were, reacting to all of this. And that is one thing that a lot of Nigerians need to perhaps see to begin to believe that you need to take responsibility. Now, in taking responsibility, what should that be? Because it seems some people have forgotten that I need to take responsibility. like you rightly mentioned, they have breached every protocol put in place by government. But now let's perhaps remind them that these are the things you need to do in taking responsibility.
So one key word that comes to mind is disease risk communication. Former Ghanaian President Jerry Lawrence died of COVID-19 recently.
Absolutely.
Sometimes we also bring it home because most people think it's a Yoruba man's sickness. Yes. It doesn't concern us. But again, when people recognize there are two angles, so you use moral suasion, but also you find ways of periodically, beyond what comes as publication from NCDC, there will be a deliberate measure of running periodic documentary. That documentary will highlight that these were those who died in Nigeria as a result of this. You may not mention names. You may mention their age. You may mention their status. You may mention locations and regions. That brings it to be, brings the consciousness. Oh, this person can die. And let me put it in perspective. A plumber came to my place to fix a faulty system. When I told him to observe the protocols before coming, he was reluctant. But when he stood waiting to be paid and he was watching some of the clips from CNN and other stations, he said, this thing is true. Somebody can die. That was what brought it to his consciousness. So
we need to break the communication down
yes.
to the level that even the market woman
yes.
would get the message.
Yes.
And it will send that signal to her that she needs to take responsibility. Now, what are the protocols that they should, just a way of reminding people what the protocols are again?
So you must wear your nose masks before you leave your house. That's one of the best defense you can exercise. Secondly, you must maintain social distance. You must wash your hands regularly. You should not shake. Then, in terms of gathering, people are going all out now into parties. Weddings are happening everywhere.
Christmas is almost here.
Christmas is almost here. So we must recognize that you need to stay safe to see more parties to come in years to come. And it's also very important to begin to create the consciousness that the Harmattan season may also increase the risk of infection. So we are almost into the Harmattan. In some places like Jos, I'm sure the weather has actually changed. So people must recognize that you don't need to fall the victim. Don't be the one that will be used as the person who was killed by COVID-19. So these are critical protocols. Then in the offices and markets, those rules that were originally stipulated, many are relaxing. Yes. So the Safety Commission, so that's another important side. Besides the individual, the Safety Commission need to go down to the grassroots and ensure that those rules, through engagement, stakeholders engagement, but we still have it happening. And if you check, Lagos, the figure went up,
yes.
Yesterday. A lot of people are traveling. How many of those who return to Nigeria follow strictly the rules of self-isolation? Is there anyone monitoring that? If that does not happen, how often do you also disinfect locations where people gather? Yeah, so those are things that must be done at individual level, at regulatory level, at corporate level, and at associational level. So more engagement and communication, sensitization is required to avoid what is happening. New York actually locked down yesterday, and we don't want to get to that situation.
Very importantly, Health Emergency Initiative Executive Director Paschal Achunine, thank you so much for speaking with us.
Thank you, sir.